My name is Beth Helmold, and I am the registered dietitian here at BCDI. I've been here full time for about a year now. Part of the reason why I think my role is important is because BCDI is a comprehensive treatment center. And so we like to address our patients, their families, their support persons, and we like to look at all angles of their care as well. And so when it comes to wellness, we know that our bleeding and clotting disorder patients have barriers to staying well, to keeping with a healthy weight, to maintaining a healthy lifestyle compared to the general population that doesn't have to struggle with these health conditions. And so when talking about wellness, we're going to talk about some of those barriers and what BCDI is wanting to implement to help our patients, to support you, to support your loved ones that may be patients here. So when we're talking about patients with bleeding and clotting disorders, what are some of the things that might be barriers to staying at a healthy weight or maintaining overall health? We know that some of our patients are limited in the sports they can participate in. Some of our patients have joint pain, and that limits their mobility and their activity level. We know that some of our patients have to miss days of work or school. You might miss social events because you're not feeling well, or maybe you need a treatment. And you might have overall just restricted activity, maybe just due to low energy levels, maybe side effects to medication. So we recognize that you have additional barriers to wellness, and we want to help accommodate that and help you overcome some of those the best that we can. So there is a study called the Action to Hope study, and that stands for Awareness, Care, and Treatment in Obesity Management of Patients with Hemophilia to inform hemophilia obesity patient empowerment. So we aren't just looking at hemophilia patients, and we aren't just looking at obesity, but I'm just using this example because this was a really helpful survey that helped to look at some challenges and get some opinions from patients about ways they can be best supported. So from this study, I'll read a small part. It said approximately half the patients believe that setting more realistic or specific goals can help them with weight loss. Resources to support these goals, referrals to weight loss programs, dietitians may all be helpful. So from this study, it listed some of the main motivators that these patients have to improve their health. Some of the main ones that I'll highlight: they wanted to feel better. They wanted to prevent the progression of joint disease. They wanted to address some general health concerns. So we know that some bleeding and clotting disorders go hand in hand with other health conditions, which is another barrier. They wanted to improve overall pain. Some patients wanted to stop taking medications, so additional medications for maybe other health conditions that were caused by overweight or an unhealthy lifestyle. And lastly, patients wanted to find encouragement from others who were trying to make the same health and lifestyle changes. So one of the main areas to look at is preventing development of other health conditions that might be caused by unhealthy lifestyle, overweight, or obesity. In some cases, poor growth, or maybe even being underweight. And other health conditions could be heart disease, lung disease, sleep apnea, stroke, diabetes. Sometimes health conditions can then cause infertility, arthritis, joint disease, some types of cancer. So just keeping in mind that changing lifestyle, getting a healthy weight, or achieving a healthy weight rather, can be helpful not only in addressing a bleeding and clotting disorder, but preventing the development of other health conditions. So weight management doesn't only mean weight loss. We treat patients throughout the lifespan here at BCDI. And so we want to make sure that our pediatric patients are growing well. We like to assess their growth, look at their trends on the growth charts, and make sure that they're growing appropriately and proportionally. Sometimes that might entail giving some advice to change their eating or even their activity level. And even with some of our adult patients, some patients struggle with being underweight. That might seem like less of an issue, but it can cause a lot of other health conditions. It can cause osteoporosis, nutritional deficiencies. It can affect reproductive health, and also just can affect somebody's energy levels, their immunity. It really has a global effect on their health. So reaching a healthy weight or maintaining a healthy weight can apply to all of our patients. So what is the best approach? So we don't like to approach anything with short-term solutions that are only going to help you for a small period of time. We want to help you and support you long-term. And part of that is setting realistic goals, enlisting support either from other patients that you can network with or just from your providers here. Tracking your progress so you can see, for instance, if you are working to reach a healthy weight, how are you progressing in that? How close are you to your goal? What changes do we need to make along the way? Considering your lifestyle. So maybe if you're looking at healthy eating, what parts of your lifestyle are leading you to make certain choices? So really examining your whole lifestyle, not just certain areas. So these are factors that we consider in our approach to wellness for our patients. So what are some of the benefits of reaching or staying at a healthy weight? We want our patients to feel the best and have the best quality of life. So typically when you're at a healthy weight, you have a better energy level, higher self-esteem and self-confidence. Also, it's really important to improve any pain, and that includes joint health. And sometimes if you're carrying more weight than your body frame can hold, that'll cause more joint problems. And we know that a lot of our patients struggle with pain. Being at a healthy weight or maintaining a healthy weight can decrease the medications that you're taking, or even just the dosage of the medication if it's something that you need to stay on. And we want you to have the ability to be as active as you can, not just in physical activity or sports, but just in your daily life. We want you to feel good so you can participate to the fullest. So as we look to implement a patient wellness program here at BCDI, what could this offer to you? We want to be able to provide our patients with guidance on physical activity. We want to provide accountability with your providers. Some patients we only may see once or twice a year. So we want to provide more consistent communication, offer you more support when it comes to making diet, physical activity, and overall lifestyle changes. We want to give you nutritional guidance, healthy recipes, and some tips to deal with stressors and emotional eating. That's something that's very common. And lastly, we just want to help to address all areas of your lifestyle and your health, whether that's drinking enough water, getting enough sleep, or managing stressors. So how could you participate as we develop a patient wellness program? You can email me at beth@ilbcdi.org. And that way I can get in touch with you as the program begins and make sure that you're included and that you get these communications. So in summary, here at BCDI, we have our comprehensive approach to patient care. We want to help address any concerns that you have and support a healthy lifestyle for you. We know that one size does not fit all, so we also want to make that specific to your needs and your priorities.